Gonna get there she is every time. All right. Well, thank you so much for joining us. I'm Jordan and I'm from Folia Health, and we are a health tracking app that's all about making treatment and care focused on you as a patient and what's important to you. So our goal at Folia is to provide you with a simple way to track symptoms, treatments, and flares, and ultimately to just have more insight about your health and have less bad days. So with Folia, you can track things like how is anxiety affecting fatigue, or is my treatment causing side effects? What are those side effects? Or how effective is my treatment at reducing things like fatigue or swelling or other symptoms that you might be feeling? And because our mental health is so ingrained with our physical health, we're really thrilled to have Elle with us here today. Elle is a licensed mental health therapist who specializes in working with adults and kidney patients. So with that, I will hand it over to you, Elle.
Hi, thank you. I'm gonna give me a minute here to pull up my slides. Can everyone see this okay?
Yes, that's perfect.
Okay. Um, Before I get started, I wanted to just say welcome to the participants and also thank you for choosing to spend this hour with me. I know there's many things that you can be doing, so I appreciate you being here with me to learn a little bit more about this interactive workshop, Cultivating a Helpful Mindset While Navigating Uncertainty with Chronic Kidney Disease. I also want to say thank you to Folia Health for sponsoring this workshop and making it possible for the kidney community to come together and share and talk more about mental health and how we can all cope better. A little bit more about myself. My name is Elle Lee, and I live in Temecula. I am a licensed clinical social worker, and my education background is in psychology and social work. And in my career, I have worked as a dialysis social worker for Fresenius. And now I am a mental health therapist. In my own private practice, I specialize in anxiety and depression conditions. And I primarily work with adults and kidney patients at whatever stage they are at with their chronic kidney disease, whether that's diagnosis or post-transplant. Um, with that being said, I know we have one person here today, but if you want to volunteer and share your name and location, you can do so. If not, that's totally okay too.
And you're also welcome to put any answers in the chat if you don't feel like unmuting your microphone.
Just to ask, is the one person me?
Yes, it
Yes.
is you. You're the
Okay.
one. So, but Cortland is my colleague here, and we're going to be participating as well. So it'll still be interactive.
Okay, sounds good. Well, I'm honored to be the person attending this workshop, but my name's Cameron. I'm actually from Canada um, in Kingston, Ontario. I found this workshop just off of Reddit and was recently diagnosed with IgA nephropathy and yet to see a nephrologist, but just a lot of emotions. Was very interested in the title of the workshop, and while my renal function is still good right now, was just interested to see like what strategies would we'd be discussing, I guess, in terms of managing mental health and such. And yeah, that's basically it.
All right. Well, thank you so much for sharing, Cameron. Uh, I can understand, the fear and the worry surrounding just being diagnosed. So I'm hoping that today you're going to learn some tools to help you navigate this recent diagnosis. I was going to go over some housekeeping items, but I think Jordan covered most of it. So, Cameron, this is participation is optional. It's up to you. You can keep your camera off if that makes you feel more comfortable. Utilize the chat box. With that being said, because this is an interactive workshop, I do encourage you to take the advantage of the opportunity to share your experience, any insights you might have, and make the most of this time together. And because it's just you, you have my full attention. And think of it as a free therapy session. Um, for this workshop, though, you do need a paper and pen. So if you don't have that, then if you could take a moment to grab that, and then we can get started.
Sounds good. Thankfully, I've got some right here.
Okay, great. So I wanted to touch upon about more about chronic kidney disease and the mental health impact that it has. Um, Chronic kidney disease is complex. From it often begins first with diagnosis and the shock and the uncertainty of this diagnosis, and then trying to cope with a moment that can feel very overwhelming and life-changing. From there, the complexity unfolds. I imagine, Cameron, if you haven't already discovered this or not, but the complexity that involves in chronic kidney disease isn't just coping with a diagnosis, but it's the ongoing management of the disease progression. What is this going to look like, short term, long term? Am I going to have to take medications for the rest of my life? Do I need dialysis, transplant? A lot of these questions come up. It's also adapting to dietary restrictions. Chronic kidney disease often comes with a pretty restrictive diet, which that in itself is complex and difficult to cope with. In addition, there's managing medications and handling the side effects, whether that's starting new medications or having to be on more medications, and as well as coping with changes in personal or family roles. So for some people, they may be the financial or the emotional support person in their family. And with chronic kidney disease, that can have a significant impact on their role, their family dynamic. So given these challenges, anxiety and depression is a very natural and normal response to the demands and sorry about that, is a very natural and normal response to the demands and the changes that CKD often brings. So it's very human to feel this way when you're faced with so many unknowns and challenges and decisions to think about. However, with that being said, when anxiety and depression begin to take over, they can make navigating chronic kidney disease even harder and deeply impact your quality of life, as well as making it more difficult to take care of yourself. So today we're going to be exploring a different approach to these challenges. And instead of trying to fight or eliminate anxiety and depression, we'll focus on shifting your attention to what's within your control. So I'm curious to hear, if it's all right with you, Cameron, what's one challenge that you've experienced so far since diagnosis?
Hmm. I think one challenge I face is just trying to deal with uncertainty. I'm on the younger side, so like in my early 20s, and I feel like when you're young and like you don't have like any other diagnosis, like you feel like you're unstoppable, like nothing, there's just nothing to worry about in terms of health. But like I feel like after having received a diagnosis of IgA nephropathy and like being in the space before I've seen the nephrologist, there's just like a lot of questions that I have, like you mentioned, in terms of how will this affect my diet, how will this affect like how I live the rest of my life. Will I need to be making like Facebook posts to like beg for a kidney at some point in my life? It's very possible. So like just trying to like reconcile those emotions and like um, kind of process what they mean. So I think that would be one thing, is uncertainty. Yeah.
Okay. Well, you're in the right place because we are going to be talking about all the uncertainties that chronic kidney disease can bring, and each of them, is their own unique set of challenges. So let's dig into more about how can you work through the uncertainties that are coming up for you. So usually, typically our actions can either support or worsen our ability to manage chronic kidney disease. So understanding our behaviors and how it impacts our health can make a meaningful difference in how you navigate the CKD journey. So I'm gonna bring up a whiteboard here, and we are going to explore a little bit more about behaviors and how it has an impact on making our experience either more difficult or less difficult. All right, so can everyone see this whiteboard?
Yes, we can see it.
Okay. So we are, oh,
Ooh, sorry, I drew a line accidentally.
that's okay.
No, it's perfect. It's interactive.
There you go. So we're going to be exploring more about how behaviors can affect our quality of life and how we cope with chronic kidney disease. So there's two types of behaviors. One of them are good behavior. I mean, I'm sorry. Yes, good behaviors that give us good consequences and make our life better. And then there's another type of behaviors that, creates bad consequences for us. So we'll first talk about the type of behaviors um, that give us good consequences. And we call those, oh, okay. And we call those values. So most of us have heard of values before. We have an idea of what they are. And so if I could get some help from you guys, what are some of your values? What comes to mind? So values are what's important in our life, who we want to be, and the kind of life that we want to live.
I'm happy to jump in here. So I think one for me is integrity. I feel like that's always been something really important to me. And then like family. Should I be writing these down? Okay. I wasn't sure if I was supposed to do it.
Yes, I will let you know when you'll need that paper. Okay, so integrity, you said family.
Think kindness is a big one for me.
Okay.
I think I would have said kindness as well. I think connection is also something very important to me.
Yeah, I like that one. I feel that as well with the connection.
I get a couple more to add to the list.
I don't know if curiosity counts, but maybe
Yes, it
Yeah.
is. That is a quality.
I think like authenticity or just kind of like being true to yourself.
Okay.
I don't know if this is a value, but like just um like happiness, like laughter, like those kinds of things, like smiling. I don't know how to put that into a single value.
Happiness or joy that, it is a quality, right? That um, im improves your life, gives you good kinds of consequence. Like if you are experiencing joy and happiness, those are more of the good stuff you want in your life.
maybe
The
patience.
patience, yes. One of my word for the year that I'm trying to also a value that I'm trying to practice more too is acceptance.
Oh, that's a good one.
Yeah.
Mm.
I think another one that I was thinking of is balance, like trying to find balance in all facets of your life. I think that's probably one of the hardest ones, but something that definitely helps me feel better on my day to day when I do have balance.
When you think about balance, what's an area that you would say like maybe is lacking in your life that you want more balance of?
Um, Everything right now, I feel like my life is a little unbalanced, to be honest, but I think maybe just I don't know. I think just finding time, finding the right amount of time to do everything. I think maybe I just overexert myself in certain ways, and then I just kind of lose sight of maybe not sleeping enough or um, not prioritizing exercise or things like that. So,
Yeah. So let's say in this scenario, time for self-care,
yeah,
right?
I think that's
Sleep,
a good one.
exercise. All right. So you guys get the idea here. Values are um, all the good stuff that improves our lives. And when we're doing it, when we're being a part of it, um, behaving in a way to honor our values, then it brings us joy and happiness in our life. Now, the other side of
I'll
behaviors,
see really quickly, Elle. I'm so sorry. We had someone else join us, so I just wanted to take a quick moment to welcome you and just let you know that this is being recorded for all of the people who weren't able to join us live. If you would like to, you can change your name by just kind of hovering over and clicking on the three dots if you don't want your real name shown. And it is interactive, but if you do not feel comfortable participating, you are more than welcome. Stay off camera. You can stay on mute. You can use the chat or just do whatever feels comfortable for you. But welcome.
Thank you.
All right, sorry,
uh,
Elle, handing it back to you.
oh, no, no worries. So Jeff, you're just joining, and what we're talking here more about is looking at two types of behaviors that either improves our quality of life or diminishes our quality of life. And so we were just talking about one type of behavior under values. And so values are all the qualities and things in life that's really important to you. And so we were just listing values, uh, some values for uh, us to have on paper, to look at and to compare with the other side of behaviors that we're going to be talking a little bit more about. And those behaviors, we called them, those behaviors on this side over here, we call behaviors that lead us to suffering. So I'd like for you guys to all think a little bit more about what kind of behaviors might lead you to suffering.
Maybe like overthinking. I think that's probably one that I do a lot.
That's on my list.
Overexerting myself, I think, is a big one for me.
Oh, you said overexerting?
Mhm.
I think of jealousy and comparison as one.
Yes. Okay.
I also think about like oh, sorry, I literally lost my my words. Um, Procrastination.
I think ruminating is one that I do.
Yeah, or just worry.
Yeah. Another one for me is like lack of focus. So it's like when I think of like 10 things I have to do at once. And so then instead of just like getting one done and then moving on to the next, my mind is like trying to think about all of them, which ultimately leads me to get nothing done. So I don't know what word that would be.
Yeah, it sounds like overthinking to me. Like there's just a lot going on in here and thinking about multiple things to do all at once or that you want to do at once.
Maybe like guilt or like blaming yourself for things.
Mhm.
It's probably,
Yeah.
or maybe like
And I
the
wanted,
opposite of self-care, like self-criticism.
I
Mm.
was just going to say that.
Perfect.
Yeah, negative self-talk.
Yeah.
In my work as a therapist, working with adults and kidney patients is the negative self-talk is so pervasive. Yeah.
Yeah, it's a hard one to overcome.
Mm.
Maybe like resentment.
Yeah, that's true. I often have, like on TV or something, I'll watch someone and I'll be like, yeah, his kidneys are fine, you know?
Yep.
Right?
Comparison.
Yep.
Cameron, when you first received your diagnosis of IgA nephropathy, do you remember something that, you know, a behavior you were doing that was keeping you stuck?
Hmm. Um, Preventing me from thinking about like being more future oriented or kind of about planning. Is that what you mean?
Well, what did you find you were doing that wasn't helpful, that was causing suffering for
Oh,
you?
okay. I see. I see. Yeah. I felt like I had a lot of regret, which was very strange because IgA nephropathy, from what I understand, doesn't have like it just happens randomly. But I spent a lot of time just overthinking, like regretting, just like wondering, oh, like was there something that happened? Like, did I get unlucky through some kind of means? So I think I that led to a lot of overthinking and just like sitting in my room thinking.
Yeah, that's, you know, line over here with the guilt blame, and there's like some regret, you know, in this umbrella over here. And then the overthinking was the overthinking, that was what was involved in the overthinking for you.
Yeah.
Okay. So this is a pretty easy concept to understand, right? It's like when we are doing stuff on the suffering side, our quality of life diminish and um, it takes us away from living the life that we want, from experiencing happiness, joy, and moving forward or living our life. And then on the other side here, values is when we are engaging in these behaviors over here, our quality of life is good. We're happy. We are enjoying life. We are living our life and creating our life the way that we want, how we want to, that's meaningful for us. So pretty easy to understand these two differences. It's like in theory, stop doing the stuff on the suffering side and do more of the values, right? But as you all have experienced at some point in your life, and maybe even now, it's much harder to do. Uh, if somebody wants to be a little vulnerable and wouldn't mind sharing that where you are at currently in your life today, like where would you say if you had to show with your hands where suffering is in your life and values are in your life, like what are you doing more of with the show of your like with the show of your hand?
I'm not sure if it's just my view. I'm going to take us off of pinning you just for a moment so that we can see anyone who is on camera. But
I would say for me, like suffering would probably be a little bit higher. Kind of gone through like a pretty hard couple of years. But I'm really excited. I just moved to my new apartment. So I think I'm hoping that the values are starting to creep up so that I can find a little bit more of that balance that I was talking about.
Yeah, yes. And in this workshop, you're going to learn more about how can you find more balance with those two. Uh, Usually in my work as a therapist too, people come and they're more on the suffering side, particularly too with chronic kidney disease. There's more behaviors on the suffering side than there is um, behaviors aligned with values. Um, Now, there's something that gets in the way of us being able to stop doing less of the behaviors on suffering and more of the behaviors on values. And we call that the mind. So going back to our focus on behaviors, I like for you all to think about some of the behaviors that you did today.
I drank coffee.
Mhm.
I worked. That's pretty much all I've done today.
Yeah.
I walked my dog.
That's
Uh-huh.
I actually went to the nephrologist today.
Oh, I went bouldering with a friend.
Bouldering.
Yeah, or rock climbing.
Oh, okay. Okay.
I ran some errands.
I moved yesterday into a new apartment, so I did a lot of in my spare time some moving and organizing and all the stuff that comes with moving, I guess.
Oh my goodness. Hopefully it all went smooth and you're like in the process of, getting settled.
Yes, definitely.
Looks like there's some pictures to hang up there.
Yes, there are.
Oh,
It's still not done, that's for sure.
I just noticed that now that you pointed it out, Jeff.
Yes, all my art is still, it's floor art right now.
Yeah.
Um, I had lunch today.
I got a sushi burrito.
Okay.
I made my bed. That's a good one.
Oh, I took a shower.
Ah, okay. And as you were doing all of these behaviors that some of these behaviors that you had done today, how much of it did you actually have to think about it? How much of it, that you had to deliberately think about doing?
I think probably a decent amount. I guess I did, coffee tends to make me anxious, but I was really tired, so I guess I was going through a little bit of a mental battle of whether I should get it or not. So I was definitely put a little bit of extra thought into the coffee of it all, but I feel like working and making my bed and those types of things, I tend to, well, I obviously do go to work every day, but and then make my bed, I tend to try to make that more of like a habitual thing, but coffee I try not to drink that much. So it was a little bit more of I think something I really like thought about.
Yeah. With most of these behaviors, right? Like working, walking your dog, running errand, shower, eating lunch, um, you don't really have to think about. Like it's a habit, it's a pattern, it's something you do, right? Like when you go and eat lunch, you're not thinking like, oh, how should I eat this lunch? It just is a automatic response.
Yeah, I would say that. I think like it's almost like I have to think like, oh, like it's time for me to take a shower, but then like taking the shower, like I don't think about the things that I do in the shower. And then like even the errand, it's like, oh, I need to go to the post office. But then I don't think about like I'm not conscious, like I'm consciously driving. I'm not like being unsafe, but like you almost go on like that autopilot.
Even
Yes.
even even going to the nephrologist because I've done it so many times. I mean, I had to remember like, okay, I'm going at this time, but then there's the usual thing, right? I go and check in and yeah.
Yes. Absolutely, right? Like doctor visits, taking medications. We don't really have to think about it. We just do it. And it's exactly what you said, Jordan. So when we are doing this, these behaviors that we don't have to think about, we call that, where can I put this? We call that autopilot, right? And autopilot's very useful. I mean, if we had to think about doing all of this stuff, like our brains would explode. Life would be very hard if we had to think about how to shower, how to get in the car and drive to work, right? Scheduling an appointment, seeing our doctor. So autopilot is very useful. But what do you think happens when we stay in autopilot on the suffering side over here? When we're in autopilot, well, what do you think happens when we are in autopilot with negative self-talk,
Yeah,
overthinking?
I would say probably overthinking is an autopilot thing for me that I have to like actively work on not doing, kind of like to the opposite effect.
Yeah. It just kind of happens, right?
Yeah.
The overthinking, the negative self-talk, the ruminating,
Yeah.
it in autopilot. If we stay in autopilot in there, it leads to suffering.
Definitely.
Yeah.
I feel the autopilot on the suffering side like most, especially when like on days where like I'm scrolling on my phone and I'm feeling like pretty bad, but then I'll keep looking at the clock and scrolling and then keep looking at the clock and I see it go, but I I feel quite it's really difficult to break the thought process and like get up and do something else. So yeah, I think that's when it's most apparent to me.
And that's absolutely true, Cameron, because uh, it's very difficult to come out of the suffering side when you are in autopilot. And so, how can we get out of autopilot so that we can then shift from the suffering side to more of the behaviors on the value side, what we care about, what's important to us? Because when we are in suffering side, we aren't living our life and being the person and doing the things that we want to do or be. So to get out of this autopilot, there is the idea here of the here and now. It's the idea of being in the here and now. And what what do you guys think the here and now means?
Probably just being very present in the life that you're living.
Yeah.
Yeah, it seems to be the negative self-talk and the overthinking and guilt and so forth uh, seems to be focused a lot either on the past or on the future,
Mm-hmm.
right? Like the overthinking, it's like, oh man, and eventually my kidneys are gonna fail, and oh no, I'm gonna whatever. But and then I guess you run the risk of ignoring, like, oh, but I'm not there yet right now. I'm fine, and I can do things right now, you know?
Right. Well, that's what you're missing out on. That's what it's taking away from you.
Yeah.
When you are in, can you guys see my cursor here? Okay.
Yeah.
When you are in the mind, in autopilot on this side, it takes away from here. What's in front of you? What's in your control? What can you do about, right? Because when you are ruminating or overthinking um, in the past, when you're stuck in the past or living in the future, you're not able to be here now and be in control of what's in front of you.
Yeah.
So a skill to help us turn off that autopilot and to help us to be in the here and now, to be present, the skill of using our five senses. So our five senses are taste, touch, smell, feel, hear. And to help us understand more and distinguish the difference between mind and here and now, we're going to do a little activity. So I like for you all to grab something in front of you. That could be a pen, your phone, maybe if you're drinking water, just something that fits in the palm of your hand. And we are going to use our five senses to engage with the object of your choice. So you're gonna feel it. You're gonna smell it. You can taste it if you like. Um, and you are just gonna be with it for 30 seconds. So I'm gonna give you 30 seconds to use your five senses to be with your object. So go ahead and we'll get started now. Okay, we'll call that 30 seconds. And then now I'd like for you to put that object down and away, preferably out of your sight. And for the next 15 seconds, and I'll let you know when to get started, I'd like for you to recall in your mind as many things you can remember about your object. So some people like to close their eyes and do this or keep their eyes open. Either way, it's okay. Either way, it's fine. So go ahead and get started. Okay, we'll call that 15 seconds. And I'm curious to hear from you guys. What kind of things did you notice during this exercise when you were doing it using your five senses and then when you were doing it in your mind?
So mine was, I just grabbed a pen that I literally write with every single day. And there was like so many more things about it. It's like a simple pen, but like there's actually like multiple textures on that pen. And like the sound of the click is like quite sharp. And I was like, oh, I kind of like that. And it's like all of these things that I've never like noticed before, I guess. And then I feel like it was easier than I thought to like recall it after, like in that 15 seconds. I was like, oh yeah, like I can remember like those things about it. And I've had these pens for 2 years and I've never noticed these things about it before.
Yeah, Jordan, what you described right now was the distinction between mind and present. When you were using your five senses, you were in the present. You had through your senses, you had awareness of the touch, of how it looked. You had these pens for 2 years and noticed things about it that you hadn't before.
Yeah.
Right. And then in your mind, the autopilot switch went on, and it was like, it's this color, it's that, da da da. You're recalling.
For me, I had like a small planner that I think I got from a bookstore, I guess. But when I was initially like using my five senses to process it, um, I guess like I never processed like this how it smelled, like in terms of like the smell of like new pages of books or paper, like the smooth texture of it as well. And when I was able to envision it in my mind, at least, I was like pretty surprised that like when I could focus on each of the like aspects of it, like how well I could recall it. And I found it was like pretty difficult to think of anything but that. So it was a very grounding thing.
Yeah, thank you for sharing that, Cameron. And that's exactly how using the skills um, can bring you to the present and turn off that autopilot switch for you, right? it just allows you to turn off that switch when you're in autopilot so that you can you can steer your boat in a different way. And move towards what's important to you.
I had this cup and it's like very interesting in terms of like how it feels. It has all these little bumps on it. And so that was obviously like a big thing that I noticed. And like I drank the water and I looked at it and whatever. So I felt like I really used all my senses. But I mean, I think partially because it is such a unique cup, but I realized when I was closed my eyes and was thinking about it, all I could think about was the touch of it, not as much all the other things. Which actually made a lot of sense to me because I've always been very like aware of my like tactile things of like things that I touch and like how things feel in terms of how soft they are or if they're itchy or scratchy. Like I've always been very tactile defensive my whole life. So it made like a lot of like I kind of made that connection in my head like afterwards that like I was kind of like really focusing on the touch as opposed to the other five senses or four senses.
Yeah, and I think that's hitting like a value here. Like it sounds like that value, as you were talking about it, there was joy in your face, and even in your tone, and also curiosity. Like there's like this curiosity part of you that's like, oh wow, like this is, really interesting and cool, and it brought you joy.
Yep.
And
Yeah,
and
I
so
thought I thought similar too about, so I have this pencil here, and as I was touching it and feeling it, I was like, wow, this simple little stupid thing has different a lot of different things to it. You know?
Mhm.
Like there's a pointy part here, and it's all smooth over here, and then where the text where the words are, it's like I can feel the paint there. And yeah, kind of like Cameron, he was saying like, oh, that simple thing actually has a lot of different complex things to it.
Yeah. What do you think maybe could be a value of what you were appreciating now? Like, what was it about the pen that brought you some joy in it?
Uh, I think it was just kind of I was just kind of observing and being like, oh wow, this is bumpy over here and smooth over there, and that's kind of interesting. You know, just a simple sort of curiosity, I guess, or just observing how things are different and things change.
Yeah. I think to your point, Jeff, like it's such a mundane item. Like we don't really think about it, but when we pay attention to it, right, it's a whole different experience.
Yeah.
And that's very much how our behaviors, right, have an impact on mental health or quality of life. If we're doing more of the suffering, we're going to have more mental health challenges. And if we do more on the value side, right, we are going to increase or maintain a good quality of life. And tying that with chronic kidney disease is that wherever stage you are, we tend to be stuck in some type of suffering behavior, right? For some people, it might be like, well, with this diagnosis, I can never do X, or when I get better, then I'll do X, right? And so do you see, if you stay stuck in that autopilot, it would lead you to a life of misery. But then if you can turn that off and be in the here and now, then you're able to make a different choice. You're able to make a different choice in the sense of what is in your control. Maybe you may not be able to do the certain things you used to do, but then there are still other things. So it's important to like get clear on your values because that works in hand with also being present and being able to um, take control of what you can in spite of what's happening with your health. So does anyone have questions about this board?
No, that was a very cool exercise.
Yeah, I like
Uh,
that.
I enjoyed it a lot as well.
Thank you. I appreciate that. How do I stop sharing?
There should be like a little red. Oh,
Oh, there
there
you are.
you go.
Okay. Let me go back to my screen here. All right. Now, can everyone see this slide?
Yes.
Okay. So we were touching upon values and how important it is to either know what your values are, clarify your values, get really in touch with your values because they act as a compass to help us navigate uncertainty, challenges that come with chronic kidney disease. And so, as I mentioned earlier, values are all the qualities that involve the kind of person you want to be, what truly matters to you, and what kind of life, um, what you want your life to stand for. And once you're clear on values, then you can take committed action, taking steps towards those values towards what's aligned with what matters most to you. And actions don't have to be big or grand. They just need to matter to you. They just need to be important to you enough to do it. So with that being said, I would like to see if we can all figure out or maybe get closer, have more clarity to what is a value that we deeply care about or that you want more in your life. So I'm going to pull up a worksheet here. And what I like for you to do is take a look at the list and pick a value. And if there's something on the list that is a value of yours that's not there, that's okay. Go ahead and pick it. Or if there's something else that you want to choose, it doesn't have to be the one on the list. So I'll pull it up. Just give me a second here. Can you see this values worksheet?
Yes.
Yes?
Yeah. Yeah.
Okay. So I will give you all, 45 minutes, a few minutes to take a look at this list. It was emailed to you, and I know like you can't see this whole list right here, but if you have it, it was emailed to you. You can check it out there, but I can move it up as you go through the list. All right, does everyone have their values picked?
I got mine.
Okay.
I'm good too.
All right, so let me go back here and so I would love to hear a little bit more about the value that you picked, and why is this value important to you?
I picked acceptance. And I think it's because it like really resonated with me because when I feel like I resist things that I can't change, it causes a lot more distress for me. So I'm really trying to bring more acceptance into my life and just accept what is and that I can't control everything.
Yeah. And um, when you reflect on the value of acceptance, are you living aligned with that value? So think about that behaviors board that we just did. What are some of the behaviors that you think either you're living aligned with the value of acceptance or not?
I think I try to. I'm not always. Like sometimes I do kind of like the rumination on things that I can't control. So that would be like more on the suffering side. And then sometimes I just try to move forward. Like my like theme for 2025 is just keep moving forward. Because instead of like feeling like I'm stuck in like another like a past like a I guess like an unhelpful mind loop is what I call them. So I don't always live aligned to it, but I strive to live more aligned to it.
Yeah, and this is like this activity here is helping you to build more awareness of what are you doing that's either aligned or misaligned. And we go back to where is oh I didn't save a copy of it. I was gonna pull up the
Oh,
behaviors worksheet, but I mean the behaviors whiteboard, but that's okay. Um, right? So it's something to think about. Of like, okay, this is a value that I care about. It's important to me, either I want more of or that I'm already doing, but what am I in autopilot that's either, am I in autopilot and not living in line with this value or am I living in line with it? Is there anybody else who would like to share their value?
Yeah, sure. For me, it was presence. I think similar to what I mentioned before when we were talking about suffering and me finding it hard to stop looking at the clock and then scrolling on my phone and then looking at the clock and so forth. I feel that presence is kind of a natural answer to those moments when I feel like a little bit out of my body and like a little bit out of control of just yeah, being able to feel in my body and that I can do certain thing. I can be future oriented. I can get in the shower. I can go make myself breakfast. I can go like do these things that um, might take a little bit more mental effort. So yeah, I feel like, for example, what we talked about with just like the five senses, that was like a pretty valuable exercise and another tool that I feel I could probably use in my daily life in accomplishing that and just gaining more presence when I need it.
Yeah, so your value is to be more present, is to be more aware of your surrounding and living your life in the moment, not missing out on what's happening, and
Exactly.
less of, being stuck in the past or living in the future.
Yeah.
When you think about the behaviors activity that we did it bring some awareness about like, oh, which side that you're more on and what can you try to do differently? What maybe can you be doing more of?
Yeah. I feel like overall, I would say I'm more on the value side. I feel just at baseline, I feel pretty happy about how things are going right now. But that being said, I think there's some like attributes in the suffering category that's I can aim to, I think, reduce, and certain things such as, um, hmm, yeah, like comparison is like a big thing. Overthinking is a big thing. That's sometimes I struggle with. So I think it's probably like my responsibility to just think more about like um, the types of behaviors that I have and maybe like question what they're doing for me and how I can change them.
Yeah, Cameron, and one thing that you can implement right away is thinking more about implementing a baby step. starting small, right? Something that's feasible, uh, and has a high chance of you being successful at it. So starting really small, maybe for instance, for you, the practice is going to be just having more awareness of when you are doing behaviors in the suffering and not so much taking any action yet, but building that skill, getting good at it. And then once you become good at building that awareness, then you could try on a different, take on a different strategy, but one thing at a time, and not trying to manage all of it at once. Like I need to be better overthinking. I need to stop ruminating. I need to stop doing this. But picking
Yeah,
one and getting really good at that.
that's very helpful.
Okay. Um, So, you know, for the sake of time, we're not going to be able to bring that chosen value to life using the creating your action plan worksheet that was emailed to you. The good news is that the worksheet has instructions, easy instructions to follow, and some examples. So you will be able to do that on your own outside of this without any issues. And so that's what I would encourage you to do is that now that you've picked a value that you want more of in your life or that you want to continue maintaining, that you have create a small, meaningful action plan to honor it, to make it a part of your, to incorporate in a part of your life every day.
And we'll be emailing out the worksheet, so don't worry if you couldn't find it from before. You'll have it in the follow-up with the recording.
Thank you, Jordan. And you know, this brings me to this slide here of navigating chronic kidney disease, focusing on what matters to you. This slide represents what I have learned through my personal and professional experiences. And I like to share a little bit about my personal story about how I'm navigating successfully in life through with challenges, with uncertainties, through actions guided by values. And so my connection with chronic kidney disease is not just through my role as a therapist, but I'm also a kidney patient myself. I was 26 years old when I was diagnosed with IgA nephropathy, also known as IgAN, just like you, Cameron. And I don't know if you know this or not, but IgAN is a rare kidney disease. And when I first heard about it, it was very confusing, very overwhelming, never heard of it. Also, being smacked with that news was that I also learned that I had kidney failure and I needed to go on dialysis to live. So from diagnosis to dialysis and getting a transplant, those were some of the hardest moments in my life, filled with what felt like never-ending fears, uncertainties, a lot of anxiety and depression. So I like to share with you all that one of the most important life-changing lessons that I have learned in the 16 years since I have been diagnosed is that trying to control or wishing I didn't have kidney disease, you know, didn't change my circumstances or made me feel better, but instead it truly robbed me of precious time and energy that I could have spent truly living and focusing on what matters most to me. And although shifting my focus to values and what I care most about didn't eliminate the feelings or ever feeling lost when the uncertainty came up or feeling overwhelmed with the challenges of chronic kidney disease, it did give me a clear sense of direction. And being clear on my values is a constant reminder of what truly matters to me and to me in my life and how I want to live it. And so that's the message that I want to leave with you all today, is that your values represent the qualities that define you, and taking actions within your control to honor it creates experiences that chronic kidney disease can't take away from you. That's what you have control of. Also, last takeaway and reminder is to be a friend to yourself too. We are so much more kinder, loving, and compassionate to other people than we are to ourselves. So I like to just share this coping mechanism, this tip of like being a friend to yourself too. Show yourself kindness and compassion that you would give someone you love or you love and care about. And it's something that goes a very long way when you are coping with a lot of challenges and transitions that happen with chronic kidney disease. You can contact me if you are looking for more mental health support and resources. This is my website information and my phone number. I am able to provide therapy for people who live in California and Arizona, and I provide online therapy. One of the things that patients have shared with me is that they tend to not pursue therapy because they can't afford it, but if you want therapy, if you need therapy and you want to see me, I am more than happy to work with your income and make sure that this is affordable for you and make sure that you have access to some kind of, to have access to mental health. Also, I recommend the Folia Health app. Since learning about it myself, it has really empowered my health journey and in ways of being able to track my symptoms, my treatments, and moods all in one place. And what I like so much about it too is that it's user-friendly and it also gives you personalized insights to reports and graphs to be able to identify trends and patterns in your health. And you could take this data that's already there. You don't have to worry about remembering it on what day, what time, and be able to share this information with your doctor and help you, empower you in making more informed decisions about your care. Are there any questions?
We did have the one person who wasn't able to make it live, but they submitted a question. If you have just a couple of minutes to touch on, do you have any tips for dealing with health anxiety?
Yeah, this often comes up a lot in my own practice and even in my own life, you know, struggling with health anxiety. And so this is what I have to say about it. It just depends on what's happening with you, that it would require a different method of treatment for you. So for instance, if your health anxiety is so overwhelming that it interferes with your ability to function at work, with your personal relationships, um, then I would recommend that you see a therapist and get some mental health support there. But if you are just somebody who noticed that the health anxiety is coming and going, what I would suggest you do is going back to some of the tools and the tips that we talked about here and being able to um, identify one of your values and what can you do to focus on something else that brings you meaning and purpose in spite of the health anxiety being there. So if the health anxiety is not so overwhelming where you can function, then you can lean into your values, discover more about what's important to you, and take action. That's like trying something different than, let's say, being stuck in rumination or it keeping you from living your life.
Thank you. And we also just wanted to say, or I should say, actually, any other questions, John or Cameron, before we wrap up? Or sorry,
If I may ask, Elle, if when did you have your transplant?
I got my transplant in 2012,
Ah,
so this year will be 13 years.
great, great. And how has that been?
It's been a journey. Prior to getting a transplant, I just had this belief that once I get a transplant, life was going to be all good. I didn't have to
Mhm.
worry about anything. But to my surprise, I learned that that in itself is a difficult transition in itself because with the transplant, there's also other challenges that come up. You are having to deal with side effects of the medication that can cause other health issues.
Mm.
Also, the mental health piece doesn't ever go away. It's not like the anxiety or depression goes away or mental health challenges go away after you get your transplant. Of course, I want to emphasize that getting a transplant was just just such a life-changing experience for me too, because it really did restore my quality of life, and I was able to um, live a better quality of life than I did while I was on dialysis.
Mhm.
But with that being said, there's both aspects to there's both experiences when it comes to transplant. It's not just all gravy after you get it.
Yeah, yeah. Well, okay. I'm probably heading towards a transplant in the next year or two or something. So I'm just curious.
Yes, are you on dialysis now, Jeff, or
I'm
where?
not actually. I'm not actually, um, but my nephrologist says that the way things are going, that she's saying, yeah, let's get you on the list. So so that when the time
Yes.
comes, you do it. We're ready to do it.
Okay, Jeff, one of the things that I do help kidney patients with is giving them resources and guidance to with pre-transplant. So you're more than welcome to reach out to me if you have some questions or just want some guidance or resources on where to start with getting listed. What can you do to increase your chances of getting on the list, and also how to look for donors. Is that something that you're open to? So
Yeah,
I do help patients with that. And you're more than welcome to contact me.
great. Thank you.
No other questions for me. Just want to say thanks, Elle, for the workshop.
You're very welcome.
Yes,
Thank you for
yes. Thank you
being
very much.
here. I appreciate the both of you making time to be here with me, and I hope that you found it helpful. And I enjoyed our time together.
Jordan, I think you're muted.
Sorry about that. Here I was talking and no one can hear me. The joys of Zoom. It's only been like 4 years since we've been all on Zoom all the time. But thank you all so much for joining us today, and a special thank you to Elle for putting this together and for creating these resources and the worksheets for us and then for other patients who will be able to use them. And so again, we'll be sending a recording of this, so you can look out for that. That'll also include the worksheets so that you have them as a resource to use and to continue using. And then we will soon be having like a kind of a community section. We're looking to create them for specific communities, so like the IgAN community and then different chronic kidney diseases. So more to come once we have that live, and we'll be able to list things like these workshops and the recordings and resources like the worksheets that Elle's made. So we really want it to become that hub for you to have like everything that you need to know and that you want to know. And so if you think of other types of workshops that you want to see, or other resources, Jeff, as you're kind of navigating this journey to a potential transplant, then
Mhm.
we're very, very open to feedback. We'd love to hear what you want to know and what would be so helpful for you as you navigate these journeys so that we can help provide the resources to do that. So in the follow-up email, we'll give you, you'll have a way to contact us so you can give us that information. We'll also include Elle's information so that you have a way to get in touch with her. And then we'll be doing a renal nutrition webinar next month. So more to come on that. But thank you again for your time today. We really appreciate it. And oh, Portland reminded me. So if
Yeah.
you want to download, thank you. If you want to download the Folia app and get started, you can use code L5, and that's just the invite code so that you can start tracking. And if you have any questions on using Folia, we have like in chat available. You can email us. Like there are tons of ways to get in touch, and you'll actually be talking to either myself or Cortland on the other end. So we hopefully will talk to you soon in many different ways.
Thank you, everyone.
Thanks.
Thank you.
Thank you. Bye
Have
now.
a good day. Good night.